Thursday night workshop. Tonight we're going to talk about something that's a little bit of a twist. On our page over the course of the past week, obviously we've been talking about the neuropathy workshop, and that's what we do. We do these quite frequently because we just see a ton of people who are suffering. Their lives are like really destroyed with neuropathy symptoms, the burning, numbness, tingling, typically in your feet, but also you can experience in your hands. But any kind of nerve pain is neuropathy, and our protocols work very well when we're dealing with that. You've got to figure out what the cause is for your neuropathy, because there is no one cause for everyone that has neuropathy. So that's kind of like where we excel, is trying to play health detective and figure out what's causing those problems. But what we see many times in these folks is that there's awful digestive issues. And you know that if you've seen our workshops before, there is a direct connection between your gut and your brain, and we'll talk about that a little bit more tonight. For those of you who don't know me, I am a chiropractor. I've been in practice for almost 25 years now, and I practice the same as every other chiropractor in town. I was your basic chiropractic commodity. I did the same thing as everybody else. And I got really bored at doing that, almost to the point where I was going to, get out of practice and go back to go teach over at ECU and teach in the biology department or anatomy, physiology, something like that. I just got so bored with dealing with the same boring stuff day in, day out. And then I met this guy, Dr. Michael Johnson. He wrote the book, What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, fibromyalgia, migraine headaches, and other chronic conditions. Things like peripheral neuropathy, IBS, digestive disorders, and that's when I kind of, my excitement and my interest was piqued. So I said, well, let's delve into this and let's find these people that are really in terrible, terrible shape, and let's give them a reason to be hopeful again. If you look at these things from a traditional healthcare point of view, people dealing with chronic health problems are just poorly managed. People dealing with things like peripheral neuropathy, migraine headaches, fibromyalgia, thyroid problems, Hashimoto's, digestive disorders, Crohn's, ulcerative colitis, irritable bowel syndrome. How about just folks that don't even have a diagnosis and are just constipated? It's horrific. If you are constipated, you're just miserable all day long. What if you've got, like IBS, alternating bouts of constipation, diarrhea? You're afraid to leave the house. I can't go anywhere because, what if I gotta go? When you do leave the house, you like scope out the bathrooms. You gotta know where a bathroom is at all times, because you never know when it's gonna hit you. So when we are actually, we're actually looking for folks who are dealing with these problems, because we have answers for you, and we'll talk about that tonight. One of the answers that we have is oxygen therapy, exercise with oxygen therapy. And I'm a contributing author to this book, Energize Your Brain, Change Your Life, An Introduction to Exercise with Oxygen Therapy. And that's what we do for a lot of our folks, regardless of what kind of chronic health conditions they're dealing with. Oxygen therapy is an absolute game changer. We started producing DVDs a few years back, and this is the first one that we did, Breakthrough Treatments for Chronic Health Problems, the Management of Chronic Neurological and Metabolic Conditions. And that's one of the first similarities that we see in folks who are dealing with neuropathy and IBS. Both of those conditions are neurological and metabolic in origin. So what we're talking about really is that neurological, obviously your nervous system, your brain and spinal cord, or your central nervous system, runs the overwhelming majority of the cells in your body. It's the master system of your body. And when it doesn't work properly, you can have all kinds of things like neuropathy or IBS. But at the same time, the metabolic side of things, your body chemistry, has a lot to do with digestion and a lot to do with how your nerves function. So both of these things, neuropathy and IBS, have a neurological component and a metabolic component. What makes our approach unique is that we don't just give you a drug to try and cover up your symptoms. We look at all of the things that are causing your problem, and then we address those piece by piece. We work on things neurologically and metabolically, and when we are able to do that, that's when we get fantastic results. So, I encourage you to pay attention here. Afterwards, we'll post this, and it'll be right here on my Facebook page, but share this information. I know that, if you're sitting here watching this right now, if it's not you, there's someone you know or love who's dealing with either neuropathy, chronic nerve pain, chronic pain of any kind, or IBS, or one of the digestive disorders. One of the most recent DVDs that we produced, Breakthrough Treatments for Peripheral Neuropathy. And in this DVD, we talk about the things that we do here in this office that aren't done anywhere else. And I'll routinely get the question from folks, what do you do for neuropathy in your office? So they want to know what my secret is. And I'm going to tell you, I'll explain it to you tonight. There is no secret. There's no secret. There is no one-size-fits-all approach. There's many different problems that go into why people have neuropathy. And what we do is we address those problems for that individual person. It's different for everyone. Likewise, with IBS, we can't just take a drug to cover up your symptoms. It's not fixing the problem. And not only does it not fix the problem, you're getting worse. While you're taking this drug to trick you into thinking that you're feeling better. But that's the problem with traditional healthcare approach to chronic health issues in this country overall. We're taking drugs to cover up symptoms. And, just to put it in perspective, the United States has 5% of the world's population, and we take like 75% of the world's drugs. So if drugs make you healthy, we should be the healthiest country in the world. And we're not. In 1950, we were ranked 5th. In 2010, we were ranked 50th. So we take more and more drugs, we spend more and more money. We got Obamacare, Trump care, I don't care. We take drugs up the yin-yang, and we're getting sicker. We went from 5th down to 50th. It's a flawed system. When you're dealing with an acute healthcare crisis, this is the best, in my opinion, the best medical system in the world. Right here in the United States. I mean, we've got fantastic heart centers, and we are the best when you're dealing with an acute care issue, a stroke or a heart attack or broken bones or a terrible injury, bar none. I wouldn't want to live in any other country. When you're dealing with a chronic health problem, something that's been going on for years and years, and it's just wearing you down, we fail because drugs cannot bring you back to health. Drugs are really intended to cover up your problems. And most of these drugs have unwanted side effects. And it really, every drug has multiple different effects. But if you've got a drug that has 10 different effects and you're taking it for this thing, all the other things are side effects. But if you take that same drug for this thing, then all of these things are side effects. So it's just, what is something that happens to you that we don't want to happen to you. Or you don't want to happen to you. That's what side effects really means. But what happens if you're taking this drug and this drug and this drug and this drug? Then do you think you can really be healthy if you're taking 3, 4, 5, 6? I have patients come in here with chronic health problems that are on 12, 14, 16 prescription medications. And I'll ask them, what are you taking this one for? And they say, I have no idea. And that's just a microcosm of our society. We take so many drugs, so much so that sometimes we don't even know what we're taking it for. Yet, like sheep, we keep taking them. We don't ask questions why. Well, tonight I'm going to give you some ammunition to start asking some questions why. We're going to put neuropathy here in the middle, PM. On your first visit here, we do a neurological evaluation that allows us to see what role the nervous system is playing in your neuropathy. But we also use a set of extensive questionnaires that helps me to determine what's going on inside your gut. And lots of folks are dealing with the gut issues. Constipation, diarrhea, alternating bouts, gas, pain, bloating is a very common symptom. Taking the pills, the blue pills, the purple pills. You're killing yourself if you're taking all those pills, all right? You're not fixing a problem. You will never fix a problem by taking those pills. You've got to fix what's going on here. One of the things that we work on is the gut-brain connection. There is a nerve that runs from your brain and goes to your gut. And it's like a superhighway. It's a two-way street. Your gut tells your brain what's going on. Your brain tells your gut what's going on. And as long as it's communicating properly, your brain works well and your gut works well. The issue is when one of these starts to go downhill, like you got gut problems, it's going to have a negative impact on your brain function. Or if you've got neurological issues in your brain, it's going to have a negative impact on gut function. So, when we're talking about brain, that deals with your peripheral nerves. When we're talking about gut, that could be one of the many digestive disorders like IBS, Crohn's, ulcerative colitis, whatever it is. The gut is where 80% of your body's immune system lives. So if you're dealing with something like ulcerative colitis, that's an autoimmune condition. So when the gut goes wonky, it affects your immune system, and your immune system starts to create this autoimmune attack. Your immune system attacks you. That's a bad situation. But again, what we've seen, and I've seen this over the years many times, a nice, young, healthy 20-something-year-old girl has pieces of her intestines being cut out. And they're taking out her intestines. The problem's not in her intestine. The problem is in her immune system. But nobody knows how to address the immune system. That's what we do. We look at three things: your vitamin D, essential fatty acids, and glutathione. If you can optimize those three things, you can help people's immune systems get better. But you got to remove people's triggers in their immune system. Food sensitivities, leaky gut syndrome, dysbiosis, parasite infection. Many folks have all four of those things. So if you've got these things and you're just taking a drug to kind of cover up your symptoms, they give you drugs so that you don't have these explosive bouts of diarrhea, and you can somehow manage through the day. It didn't impact any food sensitivities you had. These things don't heal your leaky gut syndrome. It doesn't address your dysbiosis, too many bad bacteria in your gut. It certainly doesn't address a parasite. Most folks who come in here with digestive issues have never even been tested for a parasite. When traditional healthcare providers look at your vitamin D, they only look at one level. You're supposed to look at 2. If you're not doing it right, why do it? You're not looking at essential fatty acid intake. Right, first of all, you should be eating it. But if you're not eating it, you take a supplement. It's not the end of the world. I'd much prefer to see people eat their vitamins and minerals and nutrients. But, if you can't, you take a supplement. Glutathione is a very powerful antioxidant. And people are dealing with chronic health problems. We see most of these folks are glutathione deficient. So we simply add glutathione in, or something like a glutathione recycler where you can kind of make more on your own. Next thing would be blood sugar regulation. And you know that blood sugar is so very important for brain function, but blood sugar is also important for peripheral nerve function. So much so that if you have insulin resistance or diabetes, that in and of itself can cause neuropathy. Likewise, blood sugar dysregulation, when your blood sugar is going up and down too high, can also be a chronic source of irritation to your digestive system. And it can contribute to things like immune system dysfunction, ulcerative colitis, or irritable bowel syndrome, or just gastroparesis, whatever it might be, any kind of digestive issues. So again, blood sugar is playing a big role in both neuropathy and your IBS. Next, when the blood sugar is gone wonky, the brain streams down to your stress glands, the adrenals. And the adrenals will kick out cortisol, and cortisol will help to stabilize your blood sugar. But cortisol is only supposed to come out under times of extreme stress, not 4 or 5 times a day. And when this keeps getting dumped into your circulatory system 4 or 5 times a day, cortisol has a negative impact on your brain, in your hippocampus. So your memory, your focus, your concentration just isn't as sharp as it was. And you just keep dumping more and more cortisol, this problem keeps getting worse. I had a nice young girl in here today, maybe 30 years old. And she says, my memory's not what it was. Well, that's not normal. And I'll tell you this, if it's 60 years old and you say your memory's not what it was, that's not normal. It's very, very common, but it's not normal. And there's a big difference. That's not semantics. Normal is what's supposed to happen. Common is what happens frequently. And in this country, memory loss is frequent. Lots of times, it begins in the gut. And there's lots of things they're talking about. Alzheimer's begins in the gut. Alzheimer's related to blood sugar. Diabetes related to Alzheimer's. They've just done research that shows that Parkinson's disease, the neurodegenerative process, can actually begin in your gut. Pathogens from here can get here and have a negative impact on the way your brain is functioning. So we need to make sure that your gut-brain connection is optimized. And we do that lots of different ways. We show you how to do that. And then the last piece of the puzzle is thyroid function. And the thyroid is your body's power plant. And that's what sets your metabolic rate. Your thyroid is, the little butterfly-shaped gland up here in your throat. And when it's functioning optimally, it produces a lot of thyroid hormone, which goes to every cell in your body, and every cell in your body functions optimally. But when your thyroid starts to go kaput, that's when you just don't have the energy. I'm gaining weight. My eyebrows are thinning. I'm not sleeping well. I've got no energy whatsoever. Depression, and I think another piece of the depression puzzle is when your frontal lobes aren't firing properly, and you keep going to doctor visit, to doctor visit, to doctor visit, and you're not getting anywhere. That makes me depressed too. I was just thinking about it. I'm taking all these drugs, I keep going to all these doctors, and they don't tell me what's wrong with me. Well, the number one reason that people have a decreased thyroid, is because your immune system is attacking your thyroid. That's Hashimoto's. The issue is that folks aren't even checked for that. This gets my goat. It burns me up. When we run a thyroid panel, we run 9 or 10 different tests. The traditional healthcare model runs 1 or 2. So if you run 1 or 2, it might look normal. If you run 9 or 10, you can find things that people aren't looking for. The most important of which, I think, is thyroid antibodies. Because this is a clincher. If you've got antibodies against your thyroid or thyroid enzymes, then the problem really isn't a thyroid problem. The problem's an immune system problem. Where could that come from? How about a gut problem? So do you see how this is all connected? So if I get someone who walks in here and says, I've got peripheral neuropathy, my doctor gave me Lyrica or Neurontin or gabapentin, do you think that Lyrica or Neurontin or gabapentin, any of these, do you think any of those can fix somebody's neuropathy if they got a blood sugar problem, their adrenals are kicking out cortisol, and they're hypothyroid? Do you think those drugs? No, they can't. You know that, right? Likewise, if somebody comes in here and they say, well, I've been diagnosed with IBS and my doctor gave me some kind of pill and I feel, this much better. Do you think that pill is going to be able to fix that person if they got brain issues, so the brain isn't speaking to the gut, there's an immune system dysfunction, and they got a blood sugar dysregulation? Do you think that pill is going to fix them? No, it might cover up their problems for a short period of time, but it cannot fix them. So here's my call to action. If you are sick and tired of dealing with whether it's chronic nerve pain or pain of any kind, or any kind of digestive issues, and you've gone to doctor, and you can't get results, and there's tens of thousands of you right here in Pitt County, I'm here for you. All right? I'm not going to promise you that we're going to be able to cure everybody. That'd be foolish. What I do promise you is that you will never find someone who is going to work harder to help you try and figure out what's wrong, and then put a plan in action to help you get your life back again. I'm up at 5 every morning, studying, learning new stuff as far as this is concerned, so I can help you be a better you. So look, if you want to find out, if our protocols can help you, call the office. I'm going to be leaving in a little while, but call the office and leave a message. This information will be up. I'll post my information underneath here, and then you can ask individually, ask me questions. Most times, folks, it's maybe not, you don't want the world knowing that you're dealing with kind of chronic digestive issues or whatever. Message me. You can message me. Or you can call me here at the office, 252-758-2222. And if I can't get to the phone right then, I'll call you right back. And we'll set up a time to chat on the phone. That's not a problem. If you just want to come on in and get an evaluation done, we can work that out too. That's not a problem. Alicia or Linda can go over that with you when you do call. So, if you don't have any issues, don't call me, right? That's the way it works. But if you are taking drugs and they're not working, and you really want to look for a solution, I'm your guy. All right, give me a call. I look forward to working with you. I look forward to helping you get your life back. Thanks.